Hello dear friends and welcome back to Wellness Hub Seniors. Today, we're diving deep into a topic most people over 70 will never hear from their doctors. But a startling reality lurks beneath the surface. New studies reveal that up to 37% of medical tests in seniors lead to unnecessary treatments, debilitating complications, or lifelong side effects. The number one on our list is now thought to cause as many as 5% of all cancer cases in the US. That's a figure comparable to the number of cancer cases linked to daily alcohol consumption. You won't find this information on a billboard, your clinic might not tell you. But the truth is meticulously buried within scientific literature. It appears so benign, yet it has the potential to quietly diminish your quality of life. And today, we're dedicated to uncovering it all. And shockingly, a staggering 99% of people over 70 are completely unaware they might be experiencing medical overdose. Prepare to be surprised, especially by what made it to number 2. It's a hidden truth about routine health checkups, the very ones designed to keep you safe. What if I told you that some of these tests, those seemingly harmless procedures, could actually push you closer to unnecessary surgery and debilitating strokes, or even cancer? Every year, millions of older adults diligently line up for these checkups, believing they're safeguarding their future. And have you ever regretted undergoing a medical test or procedure? Do you personally believe seniors are being over-tested in today's healthcare system? We're committed to reading and replying to every single comment, often with personalized tips and advice. And of course, if you find this information valuable, please hit that like button and subscribe to our channel for more empowering content like this. Consider this chilling fact. One of the checkups we'll discuss today, in this powerful video, will reveal 5 specific health checkups you should seriously reconsider after age 70, alongside the terrifying, yet scientifically backed truth about what they can genuinely do to your body. Before we delve into these crucial insights, please let us know in the comments below. Where are you watching from? What's your age? Now without any further ado, let's talk about the first test. Number 5. The bone density scan. A scan that creates more fear than benefit. The bone density scan, officially known as a DEXA scan, sounds completely harmless. It's a quick, painless procedure, no needles involved, promising you insight into your bone health and fracture risk. However, in older adults, particularly women, the results almost universally show lower bone density. Following her annual checkup, her doctor referred her for a routine DEXA scan. Rose had never experienced a fall, felt no pain, and enjoyed daily walks. The scan, however, reported osteopenia, a mild reduction in bone density, not even full osteoporosis. Her doctor, without hesitation, immediately started her on elendrol. Within just 3 months, Rose developed severe acid reflux and agonizing jaw pain. By the time she sought a second opinion, she hadn't been able to play her beloved piano for weeks. Because bone loss is a natural and unavoidable part of aging, as inevitable as wrinkles or gray hair. It's a universal physiological process. A year later, Rose was not only back to performing recitals, but also boasted stronger legs, improved balance, and not a single fracture. Strength training, balance exercises, proper nutrition, and effectively treating any existing vitamin D deficiency have been scientifically proven to reduce fractures by over 20%, according to a compelling 2022 study in Osteoporosis International. Don't let a number on a screen scare you into unnecessary treatment. Yet, armed with these seemingly alarming results, many seniors find themselves pressured into taking medications like these drugs are prescribed to strengthen bones, but they come with a laundry list of serious and sometimes debilitating side effects. We're talking about jaw necrosis, a rare but terrifying condition where the jawbone literally begins to die, and chronic esophageal irritation, making even simple swallowing a painful ordeal. But for those over the age of 70, there's a crucial piece of information most aren't told. This scan can frequently generate more undue fear and anxiety than genuine health benefit. A landmark study, published in the esteemed Journal of the American Geriatric Society, meticulously followed over 1,200 women aged 70 and older. Their findings were eye-opening, but while not entirely negligible, this marginal benefit is a far cry from a life-saving intervention. Instead, these women were significantly more likely to suffer from the medication's side effects, including persistent digestive issues, painful inflammation in the esophagus, and paradoxically, a propensity for brittle bones that fracture in unusual and painful ways. The DEXA scan measures how strong your bones are, primarily to detect osteoporosis. Here's the critical issue. Extensive studies have consistently shown that treating mild bone loss in individuals over 70 with these medications has little to no significant impact on actual fracture rates. Let me share the story of Rose, a vibrant 76-year-old retired piano teacher. We gently guided her off the medication and initiated a comprehensive lifestyle regimen. Daily vitamin D supplementation, regular weight-bearing exercises using resistance bands, and a calcium-rich diet featuring foods like sardines and leafy greens. A quick scan might seem like a smart, proactive move, but for individuals over 70 who are not experiencing falls or spontaneous bone breaks, The evidence strongly suggests that a lifestyle-first approach is far superior. But there's one scan that, when misused, can lead to something even more terrifying: brain surgery. Let's delve into that next. Number 4. Brain MRI for memory loss, a scan that can cause unnecessary panic. When seniors begin to experience increased forgetfulness or moments of confusion, the natural and understandable impulse is fear. Fear of dementia, fear of Alzheimer's. In response, many well-meaning doctors often order a brain MRI. This means seeing slight brain shrinkage or small white matter spots, findings that are completely normal and expected in older adults. They are part of the natural aging process, not necessarily harbingers of disease. But here's the unsettling kicker. Once these spots are identified, THEY can trigger a destructive cascade of fear, further unnecessary tests, and in some alarming cases, even invasive surgery. We gently explain that the MRI findings were perfectly age-appropriate. Or an acute functional decline, a brain MRI is rarely a helpful diagnostic tool for mild memory loss in older adults. A far superior and less risky first step is often a cognitive screening test. This is a simple, paper-based exam that effectively evaluates memory, attention, and problem-solving skills. It's inexpensive, highly effective, and crucially, it avoids the significant risk of unnecessary panic and invasive follow-ups. Now, brace yourself, because the next test on this list is one you've probably undergone multiple times. And it's number 3 for a very compelling reason. We then shifted his focus towards effective lifestyle interventions known to support brain health, such as optimizing his sleep, ensuring adequate hydration, and engaging in stimulating brain games. Within just 3 months, George's memory had stabilized, and he felt like his vibrant self again. This surgery may not only fail to improve memory, but can actually worsen a person's overall cognitive and emotional state. However, here's the uncomfortable truth that often goes unsaid. These highly detailed scans, designed to show the intricate structure of the brain, rarely provide the clear-cut answers patients are desperately hoping for. A striking 86% of these scans showed some form of brain abnormality. Yet, a disheartening revelation emerged. Only a meager 3% of those findings were actually linked to a treatable medical condition. This means that 97% of individuals endured the profound emotional toll of being told there is something wrong with their brain when, in reality, the findings were simply age-appropriate variations. What's worse, nearly 12% of these patients were subsequently referred for highly invasive procedures, including potentially risky spinal taps or even exploratory brain biopsies, all based on vague or misinterpreted scan results. In fact, the vast majority of MRIs performed on individuals over 70 simply reveal age-related changes. He was otherwise mentally acute but occasionally misplaced his keys or forgot names. His doctor, acting out of caution, ordered an MRI, which revealed the ubiquitous white matter changes. George immediately panicked, convinced he had a severe form of dementia. Overcome by anxiety, he stopped driving, isolated himself by no longer attending church, and his overall anxiety dramatically worsened over the ensuing months. A significant 2021 study published in Neurology Today meticulously reviewed over 3,000 MRI scans in patients aged 70 to 85 who had reported mild cognitive complaints. Consider George, a sharp 74-year-old retired engineer who came to us concerned about increasing forgetfulness. However, when we reassessed him using a standard, well-validated cognitive screening test, his score was well within the normal range for his age. The truth is, unless there are severe and concerning neurological symptoms such as sudden seizures or rapid and dramatic personality change. Number 3. The cardiac stress test. A road to unnecessary heart procedures. The cardiac stress test is one of the most common procedures prescribed to seniors complaining of mild fatigue, occasional chest tightness, or simply a vague feeling of not being what they used to be. This test, which monitors your heart's activity while you walk on a treadmill or after being given medication to simulate exercise, is intended to spot blocked arteries, a crucial indicator of heart disease. However, for individuals over the age of 70, especially those without clear, definitive signs of heart disease, this test often precipitates more harm than good. Its primary danger lies in its propensity to trigger false alarms and subsequent unnecessary risky heart procedures. During a routine checkup, he casually mentioned that he sometimes felt a bit tired when climbing hills, significant shortness of breath upon exertion, or a notable drop in energy during even light exercise. Then a stress test may indeed pose more risks than benefits. A much safer and often more informative approach is typically a resting EEG, which simply examines the heart's electrical rhythm while you are stilled, or even a coronary calcium scan, a radiation imaging test that precisely shows whether dangerous plaque is actually building up in your arteries. These alternatives are safer, simpler, less invasive, and far less likely to propel you into a heart procedure you truly do not need. His doctor, aiming to be thorough, scheduled a stress test. The results were ambiguous, leading to a referral for a cardiac catheterization, a procedure involving inserting a tube into the arteries to check for block. A mild narrowing was detected, and a stent was immediately placed. That very night, Raymond suffered a severe reaction to the contrast dye, developing acute kidney problems. He endured a 6-day hospital stay and required weeks of follow-up care. Crucially, his fatigue never changed, because, as it turned out, it wasn't a heart problem to begin with. He was simply an older man who needed better hydration and more strategic rest periods throughout his day. The core problem is its accuracy in older populations. Studies show that in adults over 70, the false positive rate for stress tests, meaning the test indicates a problem when none truly exists, can soar as high as 40%. A false positive doesn't just cause momentary concern. It initiates a cascade of further, more invasive tests, such as and even leads to unnecessary stent placements or bypass surgeries. A monumental 2017 study published in Cardiology revealed a shocking statistic. More than half of all stents placed after stress test referrals were done in patients who had no real symptoms or genuine clinical benefit from the procedure. These patients experienced no improvement in their survival rates or overall quality of life after undergoing such invasive procedures. What they did experience, however, were significantly higher rates of serious complications, including bleeding episodes, acute kidney injury from the contrast dyes used, and prolonged, arduous hospital stays. Consider Raymond, a spry 75-year-old retired postman who diligently maintained his health by walking every day. If you are over 70 and not experiencing classic, unmistakable cardiac symptoms, such as undeniable chest pain during activity. Number 2. Colonoscopy. You likely didn't expect this one to be so high on our list, but the colonoscopy, a procedure that uses a long, flexible camera to examine your entire colon, is not always a wise choice after age 70. And it is almost universally not recommended after 75 unless there are very specific and compelling symptoms. Furthermore, the sedation administered during the procedure poses added risks to delicate brain function in the elderly, potentially leading to cognitive side effects. And perhaps most surprisingly, the procedure itself carries inherent dangers, including the potential for bleeding, tearing of the bowel wall, or even dangerous heart rhythm disturbances during the sedation phase. She had absolutely no symptoms, no bleeding, no changes in bowel habits, and no family history of colon cancer. For those in excellent health, a much safer and less invasive alternative is often a stool-based test like the FIT test. It's a test you've almost certainly had done. This is a non-invasive, home-based test that requires no harsh preparation, no sedation, and it still effectively catches most concerning cases of colon cancer. Always ask your doctor about these safer alternatives, because once you're in the colonoscopy pipeline, it can be incredibly difficult to exit. However, her new primary care physician, fresh out of residency, strongly urged her to get a screening colonoscopy. Dana, trusting her doctor, agreed. During the procedure, a small polyp was removed, and she was sent home. That very night, she experienced intense abdominal pain and fainted. At the hospital, doctors discovered a bowel perforation, a tear in her colon. She endured 9 days in recovery, lost 10 pounds, and hasn't been the same since. When we reviewed her case, we found she had already had to clean colonoscopies in the past. There was simply no compelling reason to repeat it. The hard truth is, the risks associated with this procedure significantly escalate with age. Their findings were stark. For every 1,000 colonoscopies performed on patients over 70, only 2 lives were ultimately saved from colon cancer. In stark contrast, over 20 individuals experienced serious complications from the procedure. This translates to a concerning 10-to-1 risk-to-benefit ratio in this age group. Moreover, even when polyps are discovered during a colonoscopy, many are small, benign, and incredibly slow. In older adults, removing these insignificant polyps can sometimes cause more harm than leaving them undisturbed. The preparation alone for a colonoscopy is notoriously harsh, involving powerful laxatives that can induce severe dehydration, debilitating dizziness, and even acute kidney issues in older adults. A compelling 2019 study published in JAMA Internal Medicine meticulously followed over 1.3 million Medicare patients aged 70 and older. Consider Dana, a vibrant 73-year-old grandmother who successfully ran a small bakery with her daughter. The U.S. Preventive Services Task Force now strongly recommends stopping routine colon cancer screening at age 75 for most individuals. And now, we've arrived at what many experts consider the most overused, most dangerous, and potentially most harmful checkup for seniors. Number 1. Annual full-body CT scans. The most dangerous general screening, the annual full-body CT scan, sometimes marketed as part of exclusive executive health packages or preventive services in private clinics, is aggressively promoted as a cutting-edge way to catch cancer early. But here's the shocking and deeply disturbing truth. These scans expose your body to an alarmingly high dose of ionizing radiation, For older adults, especially those over 70, the risk of triggering unnecessary follow-ups, invasive biopsies, and even traumatic surgeries is incredibly high. And the ultimate irony is this. There is zero scientific evidence that full-body CT scans performed without specific symptoms actually save lives. Each single full-body CT scan delivers between 10 to 20 millisieverts of radiation, an amount equivalent to approximately 500 standard chest X-rays. The American College of Radiology is crystal clear on this point. There is no proven benefit and significant potential for harm if genuine symptoms exist, like unexplained weight loss, coughing up blood, or visible swelling. Then targeted imaging is absolutely essential and makes perfect sense. But scanning the entire body without a specific focus is akin to searching for treasure with a landmine detector. You might find something, but the damage inflicted could be far worse than what you were trying to avoid. According to a sobering 2023 modeling study published in JAMA Internal Medicine, the dramatic rise in CT scans across the United States may now be directly responsible for up to 5% of all cancer cases. If you feel ill, maintain regular, honest checkups with your primary doctor, and critically, only undergo tests that are clearly indicated by your symptoms or specific medical history. Your time, your energy, and most importantly, your precious health are far too valuable to waste on fear-driven screenings that could leave you in a worse state than when you started. Have you or someone you love ever faced unexpected complications from a medical test or treatment that later turned out to be unnecessary? What happened? Please share your experiences and honest opinions with us in the comments below. We truly value your insights. Thanks for watching. A full-body CT scan can find countless harmless nodules or cysts that are simply normal anatomical variations or benign consequences of aging, but can actually inflict significant harm, particularly once you've gracefully passed the age of 70. Modern medicine is an incredibly powerful tool, but it is not infallible. Sometimes, in the pursuit of wellness, less is genuinely more. Always ask your doctor the crucial question: what happens next if this test finds something? If the answer is vague, unclear, or if the potential risks clearly outweigh the potential rewards, it may be time to pause and reconsider. And always remember, true, profound prevention begins with your lifestyle. Stay active, nourish your body with good food, prioritize deep, restorative sleep, and choose your checkups wisely. He felt great and decided to participate in a senior elite checkup at a prestigious private clinic. His full-body scan, despite his excellent health, showed a tiny 3mm lung nodule. This minuscule finding set off a devastating chain reaction. He was immediately referred to oncology, sent for a high-radiation PET scan, and eventually underwent a painful needle biopsy. The results? Benign. But the biopsy procedure itself collapsed part of his lung, leading to an emergency hospitalization and a grueling 2-month recovery period. All of this for something that, in hindsight, could and should have been left entirely alone. However, the very moment these innocent findings are observed, a red flag immediately goes up. This inevitably leads to a cascade of more scans, often with higher radiation, followed by invasive biopsies, and ultimately, overwhelming panic for the patient and their family, tragically placing them on par with chronic alcohol consumption as a significant cancer-causing factor. Think about that. 1 out of every 20 cancers could potentially be caused by a scan that was supposedly designed to prevent disease. That's not just counterproductive, it's absolutely terrifying. The problem lies in what these scans detect. Let me introduce you to Marcus, an incredibly active 80-year-old who used to teach martial arts to younger seniors. Leading medical experts now unequivocally advise that full-body CT scans should never be used for general screening in asymptomatic adults. A safer, far smarter approach is to listen attentively to your body. So, there you have it. 5 health checkups that may seem beneficial on the surface now. We want to hear directly from you.